Welcome to this video on what is addiction. I'm Dr. Stephen Melemis. The goals of this video are to give you a useful definition of addiction, to explain a simple test that can help you decide if you have an addiction, to clear up some false ideas about addiction, finally, to explain the causes of addiction, and hopefully, to make it easier for you to ask for help if you need it. Let's start with a simple definition of addiction. A drug or alcohol addiction has two basic qualities. You sometimes have difficulty controlling how much you use, and you continue to use despite negative consequences. What are some of the warning signs to look for? Addiction starts out feeling great. The negative consequences happen later. It's usually your relationships that suffer first. You become irritable and impatient. Other areas of your life aren't affected in the beginning. Gradually, your addiction grows. You feel guilty about your use the next day. In your sober moments, you wonder if there's something wrong. But you keep telling yourself it's not going to get worse. Eventually, along with the guilt, you start to feel an emptiness. In order to continue using, you begin to hide behind secrets, which makes you feel even more empty. Here's a simple test to help you decide if you have an addiction. Do you sometimes feel guilty about your drug or alcohol use afterwards? Do you sometimes minimize your drug or alcohol use to others? When people ask you about your use, do you sometimes feel annoyed? Have you ever thought you should cut down, but have been successful only temporarily? Here are the facts. If you answered yes to just one of those questions, there's already a 75% chance you have an addiction. If you answered yes to two of them, there's an 85% chance. And if you answered yes to all three, there's a 95% chance you have an addiction. How common is addiction? Roughly 10% of people meet the criteria for a chemical addiction. It can happen to anybody. 10% of lawyers, 10% of plumbers, 10% of CEOs have an addiction. It doesn't discriminate. The plumber and the lawyer may have different drugs of choice, but their behaviors are the same. What are some false ideas about addiction? It not only helps to know what addiction is, it also helps to know what addiction is not. So that way, you can't fool yourself into thinking you don't have a problem if you actually do. First, you don't have to use every day to have an addiction. There's nothing in the definition about how often you use. You could use once a week or once a month. But if when you use, you sometimes have difficulty controlling it, and you continue to use despite negative consequences, then you have an addiction. Second, you don't have to have cravings to have an addiction. You don't have to want to drink in the morning to have an addiction. Some people think about using all the time, others almost not at all. Some people only recognize their cravings just before they relapse. Third, addiction is not about how easy it is to go without using drugs or alcohol. Addiction is about how difficult it is to stop once you start using. Finally, and most importantly, your life doesn't have to be in trouble for you to have an addiction. When your life is in trouble, you've started to cross the line from functioning addict to non-functioning addict. There are lots of successful, high-functioning individuals who also have an addiction. Addiction is progressive. It gets worse over time. Bigger consequences could be waiting for you just around the corner. There's never a better time to stop than now. What are the causes of addiction? Addiction is 50% due to genes and 50% due to poor coping skills. You can't do anything about your genes, but you can change your coping skills. Why do people use drugs or alcohol? They use to escape, relax, or reward themselves. Those are essential coping skills. Everybody needs to be able to do them in order to be happy. But addicts have forgotten how, or maybe you never learned how. Either way, this is your chance to develop better coping skills. I want to leave you with one important thought. Your genes are not your destiny. Many people have come from addicted families or stressful families, but still manage to overcome their past and live happy lives. You can change your life. Many people have done it before. You can too. Until next time, I'm Dr. Stephen Melemis, wishing you a healthy and happy recovery.